Hello, good evening, ladies and gentlemen, and welcome to MedCity's Facebook, Instagram, and YouTube live session tonight. And as usual, I always believe it's a wonderful scene to have a lot of people coming and encouraging this kind of sessions. Of course, it would be unfair if I just ignore your greetings and just say hi to you and just if I start. So let me just take time to say hi to everyone. And AJ Jacob says hi and good evening. And of course, right, Imthian Faisal says hi. Okay. Akshay says good evening, sir. Good evening. Right. Mugavira. Right. If I'm sorry if I mispronounce your name, please bear with me. Right. Okay. Burman says hi, sir. Yes. Hello. Sham says good evening, sir. Good evening to everybody. Right, a lot of people. Right. Ebin says good evening. Shilpa Mohan says good evening, sir. Good evening. All right. Okay. So hello, sir. Watching from Kollam. Henna Sharma says, Henna, thank you for joining. And of course, Faith James. Good evening. So the last time I didn't understand the name, so I think I pronounced your name, or I just misinterpreted the name. I think Faith James is his name, right? Sorry for the last time when I did it. Okay, so good evening, sir. Good evening. Anabiga says good evening to everybody. Right, a lot of people, that's great. Manoj says hi, sir. Good evening. Good. A lot of people, expect a lot many to join. Maybe of course it takes little time to reach what I say, and the other end when you receive things. Sharon Mall says hi, sir. Hello, hi. All right, a lot of people, good to see again. Maybe taking a little time to see all your messages. That's it. All right. Okay. Right. Okay. Sharon says good evening again. Good evening. All right. Thank you for your, greetings. All right. So I think a lot of people are there to join. And of course, Anil Mohan says good evening. Good evening. Okay. Good. Probably today, as I promised, okay. So Faith James says, it's okay, sir. Means a lot that you remember my. Okay, great. Thank you so much. And of course, I do remember because you're one of the persons that do constantly joins the session and encourages, and probably you're trying to learn. So many people, not just one person. I just personally took your name because last time I mispronounced your name, and that's the reason, because I got corrected from one of my team members. So that's the reason I made it a point that this time I'll pronounce your word in the right way. Okay. Jijo Thomas says hi, sir. Anju Abraham says good evening. So I think Anju, after a long time. Okay. Akshay Devdas says hi, sir. Good evening. Jesse Rachel says that okay, a wonderful good evening to Johnny, sir, and to the whole team of MedCity Kannur. Right, it's a whole team, MedCity all over the world, not just being in Kannur alone. Thank you so much, appreciating that. Great. Good evening. Jobin Surik says good evening. All right. Okay. I really want to say good evening to everyone, and probably, as I say usual, we need to make this session only for just to say like exchanging the greetings. But let me just take you to what I have promised. Right, today more specifically, we are going to deal, or the coming live sessions, we are trying to speak about one of the most important modules of OET, Occupational English Test. And most often students just simply claim, or rather say, that the most toughest modules. Maybe, right, when we talk about listening, reading, writing, speaking, all these four modules, a great amount of the students just consider that writing is the toughest one. Probably, I think it's true in certain extent, not just because our English is bad, or not just because we do not know how to write. It is just because we are not habituated with this kind of writing. All right. Josmon George says hi again. Thank you. Anu Ashogan says good evening. Honey says watching. Lakshmi says watching. All right. Ashwati Unnikrishnan says, good evening, sir, and lot many things. Okay, let me just begin with, as I said, and we are going to talk about today's most important thing, as I said, writing, OET writing subtext, and I just want you to have a little basic understanding of what is exactly OET writing subtext. Right, as everyone knows, the time that is allotted is 45 minutes, and you get the case note, and you have 5 minutes to go through the case notes. We are not supposed to take pen or pencil, and you're not supposed to touch with pen or pencil. Rather, you have to go through the case note in 5 minutes of time. You have to select the relevant or necessary information that has to be part of the writing, and then you have 40 minutes wherein you can just take up your pen or pencil and start writing. And then you have to have at least 180 to 200 words, which simply mean this 180 to 200 means officials say that the relevant data would be of 180 to 200 words. If you write anything less than that, it simply means that you missed out one or two irrelevant information. And if you write more than 200, they simply say that you added something which is not necessary. So that's the only reason when they talk about 180 to 200 words. And I'm sure that you got the basics most of the time, and most of the people are pretty aware of this basic. 45 minutes, 5 minutes to read the case note, and that's what today we are going to discuss in this session precisely. And then you have 40 minutes to write. That's called transformation of relevant case note, that we will discuss later on. And of course the word count. And now, what are the types of letters that you get? And I'm sure that a lot of type letters, that is, one is referral letter, the most common type, and the second one is discharge, the common type, and transfer letter is less common. So I want some of you can just help me with, out of this three types, let's say referral letter, discharge letter, transfer letter, do we get some kind of subcategories under this, maybe under referral letter or discharge letter or transfer letter? And if you think that, those people who are watching me and you're part of this show, if you think that there are subcategories, sometimes they ask you to write a letter to to request, or requesting for home visit, or a letter to update, or letter to inform something. Do you have some kind of letters other than this grouped, and more specifically referral letter, discharge letter, and transfer letter? And if you can type in the chat, I would be grateful and to see and read. Probably we need to stick ourselves, these are the basic types, and do we get some kind other than this? Let's call it as a subcategory. And if okay, please, if you know it, type it in the chat box. We can have a little discussion regarding that. Of course, today the point is selection of relevant case note. So before that, let's understand type of letters, if at all. Right, if you can type some kind of letters, you call it subcategories. All right, non-case, unknown case, Ashwati Unnikrishnan says, of course. All right, information letter, Ashna Joseph says, absolutely. Okay, a letter to inform. Right, okay, fine. Probably this can come under maybe discharge sometime. All right, all right. I'm waiting to see your response. If at all you know it, some kind of subcategories that we don't name it as actually this type and that type, but still we can think of. All right, maybe I'm waiting to see your response. If not, let me just take you to that again. Of course, the subcategories, as Ashna mentioned, is maybe a letter to inform. All right, a letter requesting for home visit, a letter requesting for advice on diet and exercise, a letter to update of the current status of the patient. So all this can come under either referral, discharge, or transfer. So these are a home visit. Exactly. I think okay, people have Kavita Yadav. I don't really, okay, Kavita is a name, right? Okay, Kavita says actually home visit letter. So these are actually the subcategories. I don't think that you need to really worry about all those things, provided when you start. Okay, advice letter. Trincy says it's advice letter, of course. Okay, I'm writing to request advice for X or Y, on diet and exercise, of course, sometimes, right? It's not so specific, but still we can name it as a subcategories. But think that referral, discharge, and transfer would be right. Inquiry, someone else, okay, all right. Inquiry about certain services like rehabilitation services. Okay, Faith J says that there are actually options for such occasions. Now, let's forget about all the types of letters, because the point today we are going to have actually selection of relevant case note. This is the most challenging thing which I love to talk about. Now, when you are on the day of exam, there are 3 important steps involved in your letter writing. Can anyone suggest me what exactly 3 important steps that is involved in writing letter? If you can type it, I'll be grateful, because I want you to interact in the session, because it should not be somebody sits here and just speak about. Can anyone say what are the 3 important steps that you have to have when you write an OET letter? I'm waiting to see your answers, probably waiting to see from your end what are the 3 steps. Yeah, I'm waiting to see that, because there are about 100 people in this live session. So probably if you can tell me what exactly the 3 steps that involves. I'm waiting to see your response. All right. Okay. Let me just take you to what exactly the 3 important steps that you are supposed to do. The first thing is called select the relevant case note, of course. All right. There are people who are saying knowing to whom we are writing. Okay, fine. Faith James says that. Sharu Abraham says that knowing the reader. All right, that all things let's keep aside. I'm just asking, on the day of exam, the moment that you get the case note, you have 5 minutes, and then you have 40 minutes. The entire 45-minute session, you are supposed to do 3 things. The first thing is select the relevant case note, and that's understanding the case note. Okay, purpose, select, organize, and transformation. Yes, Mary Binoy says that selection, organization, and transformation, exactly the same. And today we are going to discuss how effectively that we can do that. The first step, that's called selection of relevant case note. Absolutely, understanding the case. Bensi Maria says, okay. Venkat Krishna says, good evening. Good evening. Now let me just take you the 3 simple steps. First one, select the relevant case note. Second one, organize the selected case note properly. Of course, it's also part of your assessment factors, organization and layout of your letter. So you start selecting the case note. Yes, Hannah Sharma says select, organize, and transformation. Absolutely the same thing. So select, organize the selected case note, and transform them into complete sentence or sentences. Now this is what the major 3 steps that all should master oneself. Select the relevant case note. Okay, you have 5 minutes to do that. When you do that 5 minutes, you make an organization. All right, this should come first, this should come second, this should come this should come last. All right, there is an organization of the selected relevant case note. And then you think of actually you selected and you start transforming them, because you know that they are in the node forms. Can anyone say what do you mean by node form? Can anyone say what do you mean by node form when you say understanding the recipient and the purpose, relevant case note, selection? Ashwati Unnikrishnan says a lot of things, big thing. All right, but specifically, precisely, select, organize, convert them into proper sentences. What you need to convert them? The relevant case notes. I have a simple question. What do you mean by node form? What does it mean? The not form means they are broken pieces of information. They do not have subject verb agreement and all. You have to make it, okay, diagnosis, myocardial infarction. So you might get this broken forms and you have to convert them into proper sentences. He was diagnosed with blah. So this is called conversion or transformation of relevant case note. So these are the 3 steps that you're going to or you're supposed to do on the day of exam, and this first 2 steps will be done, or maybe more specifically that first step that's called selecting the relevant data must be done in that 5 minutes of time, and then you set, of course you can also organize it according to the relevancy. So now I am going to, alright, phrase and bits. Okay, yes, exactly, Mary Benoit says not form means they are phrases and bits. They do not have a complete sentence structuring, which means a case note misses sometimes tenses, articles, prepositions, connectors, and forming of sentences, either simple, compound, complex, nothing that sort. They are broken forms of information or pieces of information. You have to put together and make them sensible sentences. That's called transformation of the case note. So 3 steps, but tonight I'm going to talk about only the first step, that's called select the relevant case note. So let's begin with that. Right now, select the relevant case note. I have made it a point here. I want all of you to understand maybe that statement. You should select the case note information that will help the reader to continue care for the patient according to the given writing task. Maybe a little clumsy, but just understand, select necessary information that can help the reader to continue the care is nothing but select relevant case note. Simple to make it. Select relevant information that would help the reader to continue the care for patient on whose behalf that you write, and that's called select relevant case note. So you should always have this sense, if I select this case note, will this really help the reader to continue the care? Therefore this is relevant. So this is what you need to keep in mind first thing. But before selecting the case note, I want you to understand a few things. While selecting the case notes, you need to decide 3 things again. The first thing, as everyone knows, whether the information is relevant to the task. Right, relevancy. Relevancy simply means the information is directly related to the care that the reader needs to provide. Imagine the information or the data must be directly related to the care that the reader needs to provide. To make it simply, is this case note relevant to the existing situation, or will this case note help the reader to continue the care of the patient? So anything that helps the reader to continue the given care or given purpose or given task is called relevant data. Make it simple, anything that helps the reader to continue the designed or assigned task or the purpose is called relevant data or relevant information. Now again, semi-relevant. You need to understand actually relevant data, semi-relevant. When I say semi-relevant, information that may help the reader to continue the care, that may help. So you just read the certain case notes and you think that, okay, this is continued care or monitoring of medication. So you are asking the reader to monitor the medication and you think that, okay, this condition would also help. Okay, this is the disease and therefore this medication must be given. All right, okay, this is helping. So in a way, if this information in any way helps the reader to continue the care, is also can be considered as semi-relevant. And finally, irrelevant. information that is not going to make any impact in the continuity of care. So these are the three things that you have to keep in mind. Specifically, when I talk about the first step, it's called selection of relevant data. Just simply take the case note and understand the purpose of writing the letter, understand the reason for writing the letter, and then you think that, okay, this is the reason I'm supposed to write the case note. All right, if I write this case note, if I write this case note in this letter, will this help the reader to execute the purpose? The purpose is urgent investigation. All right, so I'm asking, all right, I'm requesting, all right, he requires urgent investigation of something. So my purpose is urgent investigation. Will this data helps the doctor to do urgent investigation? Then it is relevant. But if I write this information, it is no way going to help the doctor to do urgent investigation, that it is irrelevant. So simply just understand the purpose and think that if it helps, that's going to be relevant. Now this, I'm sure that everyone knows, and whoever understands and be part of learning program OET knows all those things, right? Relevant and semi-relevant and irrelevant. But today I want you to participate with certain steps. Of course, everyone usually say that when you get the case note, the first thing that you have to do is actually read the writing task. So I'm going to talk about a few steps wherein you can start select the relevant case note. So the first step, as everyone says, I would also say that probably, like everyone knows that we should read the writing task first. Can anyone suggest why should I read the writing task first? I'm waiting to see, because so far I was actually talking. Now I want you to respond. Why do I need to read the writing task first? Waiting to see. Christina Joseph is watching, and Maria Varghese says good evening. Joni said good evening. Now you have the time. So far I did the talking from my end. Now you have to start talking to me. Why should I read the task first? People, those who are joining me for the first time and do not know anything about writing tasks, I'm just talking about selection of relevant case note. The first thing that you have 5 minutes, and when you get that 5 minutes, straight away the step is actually read the writing task. All right, let me just show you the writing task a bit, the case note. So here is the case note which I want to really discuss and have a little chat with. I want all of you to watch it. A lot of answers coming in, but just show you the case note. This is a case note which I'm going to talk about, and the case note of course contains a writing task which is at the bottom level at the end, and I said the first step is actually reading the writing task. Then I asked you a question, why should I read the writing task? Because anything that you get, first thing we start reading from the beginning, and why from the bottom level? So that's a question probably a person who joins and start writing OET for the first time would definitely ask, why should I read from the bottom level? Why should I read? So that's the same question I'm asking. And most of the people, to understand the purpose, to understand whom the letter should be. Right, okay, there is beautiful answer from Trincy Raju says that to select relevant data and purpose. Sharon Moll says to select relevant data according to the reader. Beautiful answers, okay, because based on that only we are able to write a relevant data. Okay, Adi Gowda says very good. Okay, to understand the relevant data, Ashwati Unikishan says depends on the purpose and the reader given the writing task, we can select relevant data. I think there is no other explanation than this, because Ashwati made it so beautifully. It depends upon the purpose and reader given in the writing task, we can select relevant data. Very good, fantastic, good, beautifully done. Jesse Rachel says to realize the need of the letter. Of course, maybe made it concise. That's called conciseness and clarity. All right, a student can locate the purpose of the letter and the identity of the reader from the writing task. Absolutely beautiful. To know the reader purpose. Good. To know whether it is a known or unknown. Yes, Mary Benoit says beautifully. It also helps to see that whether the reader and the patient known to each other or not. Good. Depending upon the task, we should write the letter. Good. Right. Okay. Then he says, I'm watching. Good. By reading the writing task, we will get the exact idea that to whom we supposed to write and pick up the important data. Very good. Fantastic. Good. This is absolutely, splendid that people are coming with, same thing but explained in different ways, put it in a nutshell. So sweet. Now let's just give me and just maybe try to put it in a capsule size what all things that you have said it. I want all of you to look at again. All right, exactly the reason I want you to look at. Why should I read the task first? The first thing, as everyone said, you will come to know what type of letter is it. Most of the time you'll understand what type of letter you are expected to write. Either it's discharge, referral, or transfer, or an updation letter, or information letter, or requesting for a home visit. Probably this is the first thing that you get it. And second thing, you will come to know who you are expected to write. Come to know who you are writing to. You understand your recipient because it's specifically given using the information. Write a referral letter, a discharge letter, a transfer letter to X or Y. So you understand your reader, either a general physician or a community nurse or a physiotherapist or an occupational therapist. So you understand your reader, you understand what type of letter, and most importantly that everyone said, the reason to write the letter. This is what the fact. The reason why am I supposed to write this letter? Using the information given above, write a referral letter to X or Y. In your letter, update the current condition of the patient, your concerns and recommendations. Oh, I have a reason to write to update the current condition of the patient, my concerns and my recommendations. Oh, these are the reasons for me to write this letter. So you understand the purpose and the reason. So which would definitely help you to select, because I need to update the current condition of the patient. So I need to pick all the current conditions. So that's a relevant data. I need to talk about my concerns regarding the patient. I'm concerned about the patient because he is an elderly man. He has a chance of a fall because he had experienced the same thing. All right, he stays alone. He has problem with managing his daily chores, activities. These are all my concerns. My recommendation, provide him temporary accommodation. Oh God. So you start selecting the case notes because this is, or these are the three reasons I'm supposed to write this letter. So please, most importantly, the reason for writing the letter is specifically clearly in the writing task, and the address which you should send the letter. It's not a funny thing, the address, because it is actually the layout of the letter. The letter has got a layout and organization. So you need to have a layout, the address to whom you write. All right, you need to have the reference line, RE line. All right, you need to have actually salutation. So all those things, okay, you should know the address. So you understand where the address and whether the reader knows the patient or not. That's the most important. Sometimes you understand from the task itself, the patient and the reader. I'm writing, write a discharge letter on behalf of someone else who is from your home, right, or nursing home, which means the patient is from the same nursing home and he was admitted and he is discharged back into the care, which means he is coming back to the place from where he was taken out. There is actually an impending relationship between the reader and the patient, though it is non-case, which means there are certain data or relevant data which is not necessary to mention because they are known to each other. So finally, so I have concised, or rather I made a little specific, because most of the people you said actually, why should a student read the writing task? You will understand the type of letter, you will come to know who you are writing to, you understand the reason for writing, you understand the address with which you should just put the letter, and finally you understand whether the reader or the recipient knows the patient or does not know the patient. If it is known, there are certain data which we can ignore, maybe past medical history or social information. Those things can be just ignored because they are known to each other. Whereas if it is unknown, this data can be relevant and important. And more specifically, I want to look at again, there's actually something that I put in the bracket and right. Reader and reason for writing helps you to fulfill the criteria called content, conciseness, and clarity. Now, content means relevant information necessary for the reader to continue the care for the patient. And that's called the content, which is one of the assessment factors of OET writing. We talk about the purpose, the content, conciseness, clarity, and genre, organization, and layout. So you have all these assessment factors, and out of these assessment factors, one of the most important is the content or the necessary information. So if you know the reader, you know the reason for writing, you can easily satisfy the assessment factor called content, because based upon the reason and the reader, you start selecting the data. So this is the first step, that when you get a case note, you have to go to the writing task. Let me just take you to the task once again and show you what exactly we are going to do tonight. Now the case note is this, and of course I want all of you to actively select the things and participate here. So this is the case note, as you can see that on the screen. Of course, it has all this patient's details, like it has actually, right, like admitted, discharge, diagnosis, medical history, right, medications, okay, social background, right. I just want you to just have a random look, okay, social and family background, nursing management and progress, and finally you have the discharge plan and then the writing task. Now this is tonight's the specific case note with which we are going to do a little experiment, okay, or experimentation, I would rather say. So the first thing, actually looking at the task. Now let me just take you there. I want all of you to have actually a little so I want all of you to look at and the writing task, and it's on the screen. So now please, can you people pick out some specific things, as I said, who you are writing to, what type of letter is this, or what is the main purpose of the reason for writing, what could be the address, all those things. I said you should read the writing task first, and I have put it actually what I said verbally. Now we are going to do it practically, and there is a writing task here. Based on this writing task and purpose, we're going to select the relevant things. Therefore, this step is very, very important. All right. Okay, can anyone tell me what type of letter is this? You can just go through it and type it because it's visible and it is clearly mentioned there. And if you can just tell me what exactly the type of letter and who is your reader and what position that reader has in this particular context of writing this letter, what should be the address? Can anyone? Yes. All right, I'm waiting to see that. Okay, discharge letter. Okay. Silla Matthews says, if I'm mispronouncing your name, please, dear, bear with me. All right, it's a discharge letter. Okay, a letter to community nurse. All right, a current condition of patient and her medical and social needs. Beautiful. It's a discharge letter. Good, fantastic. All right, this is what I know that now you understand the type of discharge letter, and you know that there are specific style of writing a discharge. Maybe all the letter would be same style and method, except maybe that introduction, because the patternization is the same for all the letter. We only just change the letter or that introduction. I'm writing to refer, or Mr. Brown is being referred. I'm writing regarding Mr. Brown who is being discharged today. So we know that the introduction changes, rest of the things remain the same. Right, very good. Discharge letter to community health. Discharge letter to community health nurse. Richo Raj says discharge letter. Very good. A lot of people. Good. Fantastic participation. Now, let me just, what I said. It is using the information given in the case note, write a discharge letter. Of course, you understand the type of letter is discharge. And write home, Miss Jane Rudick, and she is actually your reader, and she is the community nurse. So you are writing to a community nurse, and her name is Miss Jane Rudick. And of course, the positions that she handles as a community nurse, or her profession is, the position of the reader is community nurse. And now I want all of you to understand the reason for writing. Community health center, informing her about the patient's condition. So the reason for you to write this letter is informing what? The patient condition, which means out of this case note, the most relevant information is going to be the present condition of the patient. Now you start thinking of, oh God, I need to select actually the present condition. Maybe I need to talk about the health, obvious. I need to talk about all the condition in which this patient is. So I'm going to select anything that is relevant. That's called inform about the patient's condition. What the condition is the patient in now, right? That is going to be relevant again, and her medical and social needs. Now, if you were to ask me, if I were to ask me, I would always ask this question: do you have one reason to write this letter? Do you have 2 reasons to write this letter? Do you have 3 reasons to write this letter? Hereafter, everyone should understand the first thing is actually, how many reasons do I have to write this? It's only just a discharge. Hey, that's only generic purpose. I'm writing discharge. It's a generic one. I'm writing to refer. It's generic. I'm writing to transfer. It is generic. A love letter. The purpose is to express your love. That's it. So a referral letter is to say it's just a referral. That's it. But there are specific reasons that's called purpose. Now see that there are 3 reasons for me to write this letter. One is to inform the patient condition. So anything that is at the moment as a presenting condition is going to be relevant data. Now you can start looking at the case note and select, okay, this is presenting condition. This is presenting condition. Okay, this is her, diagnosis, and her condition is this, and her condition is stable. All right, or her, blood pressure is in this level. This. Oh, these are all presenting condition, which is relevant. And not only that, I need also talk about her medical and social needs. Now, when I start selecting, I'm going to think about what are the medical needs should I mention in this particular letter. So I need to start selecting all the medical needs. Right. I need to search for present condition. That's going to be relevant data. There's no doubt. I need to talk about medical needs. I don't know what are the medical needs. When I start searching, I'll get it. And then social needs. So I need to mention present condition. I need to talk about medical needs. I need to talk about social needs. So there are 3 reasons for me to write this. And I'm sure that provide details regarding the patient condition. Absolutely. Her medical and social need. Alina Anthony says, absolutely. Now tell me now, will your selection go wrong? I don't really think so, because you know that it clearly says that I need to talk about the presenting condition of the patient. So when I read this is a presenting condition, all right, this is important. Hey, not only that, I need to talk about, medical needs and social needs. And you know that when you look at medical needs and social needs, what do you simply paraphrase? What do you understand medical and social needs? How do you just use another word for medical and social needs? How could you paraphrase it if you can just do that? Maybe. I'm just asking you people, medical and social needs. It's not that getting into really, right? How do I write? She requires medical and social needs. Hey, come on. That looks so ugly when you write like an introduction paragraph, right? Right? She requires medical social needs. Come on. That's quite, not appealing. That's not so, formal, right? The genre and style, the formality is not there. So how do you really just go about medical and social needs? Probably, I think I'm waiting to see that. Provide, if you can just give me a little explanation of that, this medical and social needs. All right, okay, maybe that takes a little time. I'm just waiting to see your response. If you can just right? We say actually continued care and management. That's simple as that, right? So you continuously care and manage the things. Social things you manage, and medical things is that you care for it, like monitor. Or continued care and management would be the simple word that I know that most of the nurses are good at speaking of these things. Whenever they say medical, social, they say, oh, she requires continued care and management. Oh, good, fantastic. Probably, yes, understanding medical and social needs. A lot of people, good. Now, this is the first step. As I said, I'm just going back to where I am. So I just want, just go back. I talked about the first step, and the step is actually, the first step is actually select, so read the writing task. So I just want you to go back to where we were. So I talked about the first step, read the writing task, and you understand all those things in the writing task, which says, right, you understand who, what, like all those things. I don't want to really repeat it because it is already there. As you can see that, you understand all these points, right? What do you call, who you are writing to, the address and the position and the purpose, and everything is very clear from here. Now, the second step, I want you to just talk about the second step here. Step 2, identify your role in the letter. Maybe I talked about this one. Now I'm just talking about the second step, that is identify your role. So it's always at the beginning of the case notes, and this will give you a clarity regarding your approach to the letter. So it also shows your relation with the patient on whose behalf you are writing. So read the writing task, then go and see your role in the letter. So you understand that actually, like your relation with the patient on behalf you are writing, and you understand the patient relationship and the reader relationship. Sometimes is known, sometimes is unknown. So you understand this triangle relationship. So therefore you start selecting the case note on the basis of your understanding. So probably I would say it doesn't take much time because it's always there at the top of the case note. Let me just show you that case note once again. I want you to look at actually your role in this letter. If you look at the beginning, if you just look at, it is there. You are a registered nurse working at Newtown Community Hospital. Your patient, Miss Mary Bell, is being discharged today. So it's a hospital, right? A community hospital where Mary Bell has been for last couple of days, and she is being discharged today. And you are a nurse, a registered nurse who was taking, or who has been taking care of Miss Berrybell till date. So you understood the relationship between you and Marybell. You understand the relationship with actually the reader, because you are writing a letter on behalf of your patient who has been with you till date. Now you understood all those things, and thus is maybe just let me just take you back to where we are. All right, please understand the next one which I talked about. I want you to look at once again. Look at, so you are a registered nurse working at Newtown Community Hospital. Your patient, Miss Marybell, is being discharged. Of course, you are a registered nurse. That's what your position in this. And Miss Berrybell is your patient because she was admitted to your community hospital, that is Newtown Community Hospital. So you understood the relationship between you and the patient. Now this is what the second step. Now I want to talk about the most interestingly and the most importantly a step which maybe unlike other steps, I would rather speak about. There is one more step that's called step 3. Probably you read the writing task, you read your role, you understand the relationship and all, but I would rather say that it's always ideal, it's always suitable to go and see that the plan or discharge plan. So I want you to look at the step 3. Probably I'm just shifting from one to other because I want to talk about a few steps, that 5 minutes of time. Right, I want you to look at. If you look at this one, little more, make it bigger one. Step 3. It is ideal to check the plan or discharge plan before selecting relevant data, because in every letter we ask the reader to execute the plan that we have assigned for each patient. Now maybe this is, I'm just going against all traditions. I'm just breaking all this paradigms or this comfort zone, because we read the like writing task, so your relationship, and then you start reading from the beginning. But I want you to have a little, maybe something differently. I know that a lot of people do that. Probably this would definitely help you a little more understanding at times. So I want you to look at directly to the discharge plan. Look at here. It is ideal to check the plan. Sometimes it's nursing plan, nursing management and plan. Sometimes it's given discharge plan. So every letter, if you take every case note, you know that there is a plan for writing it. Okay, so there is a plan. Why am I supposed to write this letter? Because I have a specific plan to execute, right? So therefore it is ideal to check the plan or discharge plan before selecting relevant data, because in every letter we ask the reader to execute that plan, right? If I have a referral letters, of course I have a plan for it. If I write a discharge letter, of course I have a discharge plan. If I write a transfer letter, of course I have a plan. So that plan is the one which I want you to execute, and probably maybe to understand that plan in detail would definitely help you selection of other data which is relevant or which is semi-relevant. Because now I'm going to prove it, and I'm going to show it with the same case note how reading the discharge plan can help specifically select. So I want you to look at what I have pasted on the screen. It is ideal to check the plan or discharge plan before selecting relevant data, because in every letter we ask the reader to execute the plan that we have designed, assigned or created for each patient, and it will also help you in choosing each data specifically rather than selecting generally, right? This is what I want to say. You see, you understand the plan and you select actually specific data that is related to the plan, not generic, not generally. Now let's say briefly outline the history. So when you say briefly outline the history, there will be actually history which is actually something happened years back or years ago. Still, that history may not be relevant. That is not so specifically related to that task. So such occasions you can say, do I really need to talk about esophageal reflux, something which took place and which is nowhere related in this context? So you think of this way, oh God. So right, so understand your plan. So I would always say that go to the discharge plan and just look at, so that the other thing can select specifically. I'm just going to show you that and prove it how beautifully we can do that. Let me just take you to that. Okay, so once again, let me just take you to the file where we have the discharge plan. Right, I'll show you now. Just wait. Okay, fine. So you can see on the screen the discharge plan for Miss Mary Bell. Now the purpose of writing this letter is inform the patient condition, medical and social needs. So we understand that this was so vague, it was not so clear. Now it is very specific that I need to look for what medical needs should I include, what social needs should I include in this letter, what present condition should I include in this letter. 3 reasons for writing it, and straight away let's see what's the plan now. So the first thing, and if you can just pick it up, something that's related to the writing purpose. All right, informing the patient current condition or the patient condition. All right, include medical needs and social needs. Now if you look at here, it is so specific and clear. Now look at here, monitor medication compliance. All right, so that means what? Monitoring of medication compliance is a medical need. Not only that, monitor blood sugar levels. Not only that, alcohol intake, diet. So you are supposed to monitor medication and certain needs, that are blood sugar levels to be monitored, alcohol intake must be monitored, and monitor the diet or manage it. Now again, encourage moderate exercise program. So these are all plan of discharge which comes under either ongoing care or management. All right, what do I need to manage? I need to manage that, or I need to make sure that my patient does actually moderate exercise program. I need to also make sure that my patient has to reduce the alcohol intake and he or she has to have a proper diet plan, and above all medication monitoring. So that's the most important thing, because it is medical needs as well as monitoring certain conditions or such as diet, alcohol intake and sugar levels. These are all related to our physique and our routine things that we do it, manage and monitor. Now look at this one. So it comes almost like a medical need. Okay, now let's see it. Suggest establishment of income producing activity. Right, suggest establishment of income producing activity. This can come under, right, the social need. Again, encourage establishment of social activities. Okay, that can again come under social need. Prepare a letter to the community nurse emphasizing the need for overall lifestyle plan. Right, so this is what exactly the core of this letter. Emphasize the letter to the need for an overall lifestyle plan, because her plan, you need to make sure that the alcohol intake must be monitored, the dietary pattern should be monitored. You should also make sure that she has the medical compliance, or she has to comply with the medication, or you should also make sure that her blood sugar must be monitored. So these are the few things that are either medical or the social needs. Now again, suggesting involvement of community social worker service. So now you understood the plan for writing this letter is, first thing, talk about medical needs. Now you already understood, okay, medical needs are this. Okay, these are the social needs which I am supposed to, or I am supposed to, or I should put as a relevant case note. Now you can start selecting, all right, what medication should I select it? Okay, what is her condition, the presenting condition, that medication. Then I need to talk about, okay, social needs, I should encourage her to involve in income generating activity. Why should I don't know. So when you say recommendation that you should encourage her to involve in income generating activity, there must be a reason, and that reason becomes again relevant. Why should I ask the nurse to encourage her to involve in income producing activities? Now you understand, it is just because it is actually a recommendation, it's a plan. So if you look at everything and suggesting the involvement of social worker, so you understood these are actually the plan. Now if you want to, just you read actually the discharge plan. Now we can start selecting from the beginning. Now let's go to the things. Now this is the medical needs, this is the social needs. Exactly, the discharge plan is very simple. Monitoring medications, all right, like blood sugar levels, alcohol intake, diet and exercise program. Okay, most of actually medically and physical needs. Social needs, encourage income producing activities, encourage her social activities, and of course give emphasis actually whether she can plan a proper lifestyle for this particular lady. And finally, social needs, actually encourage the involvement of a social worker. So this is the plan. Now you start selecting all related to social needs, all related to actually medical needs. Okay, which medication should I include? I don't know. What should I talk about? Why should I ask her to have actually monitoring of alcohol intake? Probably the patient has increased the consumption of alcohol intake, or the alcohol intake has increased. I don't know. So this becomes irrelevant. All right, this is because the reason I write this one. Okay, this is the reason I have planned it. Also, I need to always select the pertaining thing. Now let's go to the next one. Now let's start from the beginning. Of course, you select actually name and age, because it's also part of what you call organization and like layout. So you put the layout, you say reference line, you say the name, sometimes you say age, at times you may not say, most of the time you say date of birth, and if it is given, right? So these are most relevant things, because as part of address sometimes, and of course the name is the one which we use actually in the paragraph, so they are important. Now if you look at actually the other things, first, admitted is important, discharge date is important, of course it's very clear, and the diagnosis is very much unstable diabetes mellitus and small infected food ulcer. This is what her presenting condition, and she was admitted for what? She was admitted for stabilization of non-insulin dependent diabetes mellitus, which has been 15 years. Now the presenting condition, the reason for the patients to be get admitted was actually like unstable diabetes mellitus. So therefore she was admitted for stabilization. So you could easily say that Ms. Maribel Bast was admitted for stabilization of non-insulin dependent diabetes mellitus, for which she has been on blah 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 for last 15 years. Now you talked about the presenting condition because the diagnosis, of course, the chief complaint, you know that actually you need to have the chief complaint, which we always include in the introduction, right? Okay, I'm writing regarding Miss Maribel, who has been diagnosed with diabetes mellitus and infected food ulcer, right? You know that this is the diagnosis because that's the chief complaint, right? It could be chief complaints because both are equally important, not one complaint here. So because that's a diagnosis, it's always important. Now again, so this is presenting condition because that's the diagnosis, which is a chief complaint, which is necessary, and the name, date of admission, discharge. Of course, these things are relevant. There is no other go because they are all presenting things. Now let's talk about the other thing, non-insulin dependent diabetes mellitus. All right, so she has had diabetes mellitus for the past 15 years. All right, for which she takes, okay, glibenclamide, okay, medication is important, metformin is important, amoxicillin is important because it's actually, you're talking about the antibiotics, which is actually used for maybe infected food ulcer because bacterial infection or something like. So you understand medication is important. Why? Because it's part of your plan, it is part of your purpose, because the purpose says inform the patient present condition, medical needs and social needs. And when you checked actually the discharge plan, it says monitor medication compliance. So what medications to be? All these medications for diabetes as well as left foot ulcer, the amoxicillin and calvinate, the both things must be the combination of antibiotics are important at this because I want Miss Jane Rodick to monitor and see the things. Now that's really important. Now if you look at social background, all right, retired from a managerial position, lives alone, because do I need to really talk about retirement? Of course, because in the discharge plan it is specifically said actually encourage her to involve income generating activity. So why should I encourage? Probably the social information says that if you look at here, income, small pension, much lower than pre-retirement income. So when I ask the nurse to encourage him to involve in income generating activity, it does mean that there is a reason. What's the reason? Oh, she has retired from the managerial position. Since then, her income has been less. So therefore, please encourage her to involve in income generating activities, which means when you give a recommendation, it must be supported with relevant data. How come that I go on a fine morning, ask a community nurse to encourage someone to involve in income generating activities? I should have a strong reasons to support. So whenever you write a recommendation, it must be supported with strong evidence, and that is the reason retirement is important, small income is important, because there is a plan and discharge plan. Again, lives alone. Why should I talk about lives alone? Because there is a social need. Encourage him or her to involve in social activities because she is at the risk of social isolation because she lives alone. Therefore, it is important. Now look at reports no relatives, no close friends, reports no outside interest. This could be simply paraphrased. You can say she lives alone or she's at the risk of social isolation. Therefore, encourage her to involve in social activities. So discharge plan supported with the relevant data. Therefore, going to discharge and selecting the data would be ideal. So that's the reason I said read the discharge. Now again, and finally, now let's say these are all social needs. Now again, since retirement, alcohol intake has increased and dietary quality has decreased. Of course, it's there in the discharge plan, says that monitor glucose level and diet and alcohol consumption, because since the retirement, the alcohol intake has increased or consumption of alcohol has increased. So therefore, monitoring is necessary. And periodic problem with doing actually medication, especially hypoglycemic medications. Therefore, monitoring is necessary. Now, this is what the advantage of looking at the discharge plan. So now you understand, okay, this is the reason I selected. And now let's move with the next one. Right. The last one, nursing management and progress, medical hypoglycemic agent to continue. Of course, there is actually monitoring of medications. We already talked about, hypoglycemic medications are important because she has had diabetes mellitus for the last 15 years. And of course, she was admitted for stabilization of non-insulin dependent diabetes mellitus. Now you link together, and this is the beauty of actually selecting based upon the discharge plan. So therefore, that is important. Again, now look at again, antibiotic therapy, review at completion of current course, because it says that actually monitoring of the present condition, right? What's the present condition? She has left food ulcer, which is responding well to the antibiotic, but still a review at completion of current course is necessary, and monitor wound, observe for signs of complications. So these are all related to medical and physical needs. Presenting condition, food ulcer, therefore monitoring is necessary. Medications, this things, therefore monitoring is important. Social needs, this. So now you do justice to yourself, stating that, of course, I got all those reasons to select relevant data because I understood writing task, because the purpose is informing the patient condition. This is the patient condition. Then I need to talk about actually little monitoring of that, because monitor wound margins, observe for signs of complications, because that's a presenting condition and certain things needed. Right, I talked about using glibenclamide, metformin, augmentin, the antibiotic therapy, because the presenting condition. Then I need to monitor because it's part of discharge plan. I need to also worry about manage the social things. Social, make sure that she involves in social activities because she's at the risk of social isolation, because she lives alone, she does not have connection with others. Reasons to be there. Again, you get a chance to talk about actually talking about encouraging her involving in income generating. Why should I ask? Because since the retirement, her income has been less. Therefore, she needs an additional income. Please encourage her. So again, not only that, she is at the risk of social isolation. Please, social workers support at this point is necessary. So this is how you need to start selecting the relevant case note based upon the discharge plan and writing task. Probably, I would say this is called monitoring and management. And if you just look at what exactly we talked about, just put me in a nutshell. What exactly you need to do is on a given day, that 5 minutes, as I said, you read actually the writing task, identify those things, then you read at the beginning and see your role. And then I would rather encourage people to read the discharge plan, because based on that plan, you could start selecting the relevant information. You know, like now you understand, it's pretty easy, right? Okay, medication monitoring. So what medication do I need to really mention? Because the presenting condition is actually diabetes mellitus and food ulcer. All right, this to be monitored, correct? All right, social needs. Okay, what are the social needs? All right, these are the social needs that is specifically here. So you get actually a clear picture of what to be selected, what not to be selected. So hope maybe I know that I was just trying to put everything together within that given 1 hour of time, but still I believe that go back and do this little exercise, going through this few steps, you can absolutely master it. And if you really want to have furthermore, I always encourage people to download MedCity's OET app, wherein we do have all these things with actually very precise and crystal clear way of explaining. Probably I took 1 hour to do these things, maybe it was too fast, but when you take this app which is so handy, please click, and it is there at one click at your fingertips, and learn it and use this app. Of course, this is an absolute solution, and please, this is, I just would love to say, it's genuinely from my heart, you just please use this kind of, like handy source or resources to master yourself, because self-learning is also important. So once again, thank you, ladies and gentlemen, for being with me at least 1 hour. And I know that it's so straining in the evening hours, but you're taking the time to watch out MedCity's live session, and we will promise you that we will come with many more helpful sessions. Thank you, everyone.